Hello, my name is Brittany Zawislin.
And my name is Kaylee Van Galder, and we are going to be talking to you today about the Laotian culture.
So, who is considered the Laotian culture, or who consists of this culture? There are many different subgroups, and they are classified as Southeast Asians. So, the majority of the population is the Lao Luang, or the lowland Laos, and then the Hmong are the highland Laos. Further subgroups include um, the Kum, Taiwan, and Lumain. So, the education influences on healthcare decisions. There was a study conducted with a Laotian-speaking nurse practitioner, and what she did was gather Laotian individuals between the ages of 18 and 34, some that were born in the United States, and some were married, some had healthcare insurance, and some of them had a healthcare provider that was English speaking. Now, what they found out was that the lack of English fluency nor the preference for the Laotian speaking healthcare providers reduced compliance. So some of these individuals requested they have a Laotian speaking provider where some just had English speaking providers. And in conclusion, the individuals with healthcare insurance were 5 times more likely to stay current with their healthcare, and those with the Laotian-speaking healthcare provider were 8.5 times more likely to stay current with their healthcare. So, the view on Western medicine. Many of these Asians believe in the concept of the Chinese yin and yang, and what this is referring to temperatures, but opposing forces of the universes that create equal energy. So essentially, yin is hot and yang is cold. And when you have a balance of yin and yang, it creates qi, which is internal harmony. And depending on the subculture, if there's an imbalance that occurs either in yin or yang, and we'll just say an imbalance that occurs in yin, which is hot, you will avoid cold items such as fruits and vegetables and be offered yang options, which is cold, such as eggs, rice, or pork. And the Laotian culture views Western medicine as a whole as hot and Eastern medicine and herbs as cold. So some of the different practices that this culture participates in, it pretty much varies among the subculture itself. But one of the popular ones is a traditional healer, and this is where these people believe that illness has a spiritual cause, and they then call in a shaman or religious healer to come perform a healing ceremony for this specific cause. And essentially, they use magic healing to treat the physical injuries that these patients are dealing with. They also participate in massages and herbal medicine. And another interesting practice they perform is the technique of coining or cupping. And what this is derma abrasion. And this is a picture of what coining looks like. So what you do is you are ridding the body of heatiness or negative energy. And they perform a downward pressure of strokes in a linear pattern over the lubricated affected area. And the object commonly uses a coin, which is why it's called coining, or you can also use a buffalo horn or a piece of jade. You want an object with a smooth edge, and then continuous strokes are applied until bruises appear actually, which when the bruises appear, it's thought to believe that this is when you are releasing that negative energy. And, you know, with not being familiar with this culture and this technique of coining, we may view this as a form of abuse when we see all these bruises over the body, but it's actually how these people deal with treating their illnesses. And the concept is that if there's not enough bruises, this negative energy is still inside the body. So they will be bruised up entirely, and that's just how they view getting rid of this negative energy. And some of the different symptoms or illnesses that they use for coining with is headaches, sore throat, cough, fever, and diarrhea. And again, as you can see on this individual's back, all of the bruises from the coining.
Okay, so the Laotian views and practices that relate to mental health and mental health care and high-risk behaviors. So Laotians are twice as likely as the total United States population to experience any kind of mental health issue, particularly major depression, post-traumatic stress disorder, and other anxiety disorders. Mental health issues are difficult to identify within the Hmong community because symptoms are often manifested through somatic complaints, and stress and emotions are often internalized. Family and the clan is the primary source of support for mental health issues, even though they have been proven to lack the capacity to recognize issues and provide proper support. Migration factors likely to contribute to mental health issues within the community include war trauma, violence, poverty, loss of culture shock, acculturation, race, and discrimination. Also, lack of English and lack of education, unemployment, and family role reversals, and intergenerational conflicts. Women were more likely than men to talk to family members about their problems, and men often felt seeking help and admitting to emotional issues was a sign of weakness, and youth generally felt comfortable talking to family members about their problems, like siblings, cousins, and aunts and uncles. As nurses, it's important that we be aware that the Hmong may be ashamed or avoid discussion of mental health issues. Discussing the common occurrence of mental illness may help allay a patient's fears and discomfort about discussing mental health. So examples of culturally respectful nursing practices and cares that could be implemented with the Laotian culture include, because many Hmong are soft-spoken, so we should avoid speaking loudly as it may make some people uncomfortable. You should avoid making direct eye contact with Hmong patients, avoid hugging or shaking hands with the opposite sex. You should also avoid outwardly complimenting Hmong children. Many Hmongs believe that if a bad spirit hears such compliments, the spirit might take away the child's soul. Also, avoid refusing refreshments that may be offered to you by a Hmong patient, especially in their home, as it may be considered offensive. Rather, accept the offer graciously and simply place it back on the table if it is undesired. Use discretion if this causes discomfort to you. Be aware that a Hmong patient may present with unusual physical markings, like what Brittany talked about, such as bruises and redness on their body. These markings may be a result of traditional healing methods like cupping, spooning, and coining. Let's see here. So the Hmong may believe that illness is caused by a combination of natural and supernatural causes, and may therefore seek a variety of specialties for diagnosis and treatment. So be sure to ask patients about their understanding of their illness and the cause, and make sure you show respect to their beliefs and tailor your education messages accordingly. Consider having patients repeat back what they have understood and clarify the intention to make sure the information is conveyed, not that their ability to understand is doubted. So dynamics of the family unit and gender roles and how it influences healthcare decision making. So Laotians usually have large, close-knit families with 4 to 5 children on average. Typically, up to 3 generations will live in per household, and extended families will often share the resources to help one another. And typically, family is responsible for health care. They prefer, pulling off my chair. So, the culture or diverse groups' view and beliefs related to death. So, hospice care is reported to be an underused resource in the Hmong American community. This has been attributed to a lack of understanding and communication. As death approaches, the elder is dressed in what is called a cob cause, which is like you see that dress in the picture. Family members must be allowed the privacy and time to express their grief. It's custom for both males and females to express their grief by wailing loudly and caressing the deceased by stroking their hair, face, and arms. They may also talk to the deceased in the belief that the person's soul remains present and is able to see and hear. Autopsies and organ donations are generally not accepted. Cutting or dismembering the body will delay reincarnation and result in negative consequences to the soul and physical body in the next life. The body should be free of metal pieces because metal objects are believed to weigh down the soul, delaying or preventing reincarnation.
And here's our references.
Thank you.
Thank you.